Safe handling of hazardous drugs. Introduction to the module. Pharmacists, pharmacy technicians, oncology nurses, and other nursing staff are at high risk while handling hazardous drug (HD). All healthcare employees who come into touch with HDs are at risk, including those associated with shipping or receiving, cleaning, laundry, and waste disposal. Antineoplastic cytotoxic drugs, anesthetics, and antiviral agents have all been identified as potentially dangerous. Cancer, organ toxicity, fertility issues, genetic harm, and birth deformities are all possible side effects of exposure to these dangerous drugs. Learning objectives. After completing the module, you would be able to recognize the importance of personal protective equipment to handle hazardous drugs. Understand the importance of the preparation area needs for hazardous drugs along with equipment for safe handling of them. Assume what are the practices should take in preparation of any hazardous drug. Explain how the disposal facility should be conducted. Handling of hazardous drugs. Employees preparing cytotoxic or other hazardous drugs must adhere to the following steps to ensure safety. Personal protective equipment. Preparation area. Work equipment. Work practices in preparation. Disposal. Personal protective equipment. Chemotherapy and other hazardous medications need the usage of gloves that have been tested for use. Permeation will be resisted for much longer with a second layer of gloves than with a single layer. When synthesizing hazardous medications and administering antineoplastic hazardous pharmaceuticals, double gloves must be worn. If gloves get soiled, torn, or punctured, they must be replaced as quickly as possible. Otherwise, they can be worn until the employee leaves the preparation area. USP 800 recommends changing gloves every 30 minutes, unless the manufacturer's documentation specifies otherwise, after which they should be discarded in the biohazard box and replaced with new gloves when the employee returns. Before putting on gloves, employees should wash their hands, and then again after removing them. A protective disposable gown with a closed front, long sleeves, and elastic or knit closed cuffs must be worn, with the cuffs tucked under the outer pair of gloves, made of lint-free low-permeability fabric, such as Tyvek. If the gown is ripped or obviously polluted, it should be replaced as quickly as feasible. If gowns are to be reused, they must be stored in such a way that the outside and inner surfaces do not come into contact. Gowns and gloves must not be worn outside the preparation area once they have been used in the preparation. All used gowns, gloves, and disposable materials from the preparation should be discarded in red biohazard boxes. The Biological Safety Cabinet (BSC) should provide critical eye, face, and respiratory protection as long as work is done inside it with the sash at the proper height. Work should never be done outside of a BSC or another appropriate containment primary engineering control (CPEC) described by USP 800. Preparation area. Only restricted, defined areas should be used to produce dangerous medications. The pharmacy should prepare all hazardous pharmaceuticals that would be supplied to patients. Signs prohibiting unauthorized personnel from entering should be widely displayed. It is forbidden to eat, drink, smoke, chew gum, apply cosmetics, or store food in the preparation area of hazardous drugs. Chemotherapy or hazardous drug spill cleanup procedures for the pharmacy must be posted or preserved in a place where all employees can view them. In the location, there should be an eye wash station. Work equipment. Cytotoxic medications should only be reconstituted in a containment primary engineering control (CPEC) designed for that purpose, such as a Class 2 or 3 BSc, also known as a vertical flow hood, or in a compounding aseptic containment isolators (CACI). A continuous monitoring device should be installed in each BSc to ensure appropriate airflow and cabinet performance. Except when the hood is being mechanically fixed or moved, the exhaust fan or blower on the vertical airflow hood should remain on at all times. The hood should be decontaminated before reuse if the blower is switched off. The cabinet should be placed in a region with little air turbulence to prevent leakage into the environment. A disposable plastic-backed absorbent liner must be used to cover the preparation surface within the CPEC, which must be replaced once the day's preparation is completed, or after a shift, whichever comes first. If there is a spill, this liner should be replaced right away. Syringes and intravenous sets with luer lock fittings should always be used, and syringes must always be large enough so that they need never be more than 3/4 full. A covered sharps container should be available in the CPEC. An appropriate biohazard box and blue bin should be available nearby for disposal of used containers, gloves, gowns, paper liners, and other contaminated materials. Reusable materials should be wiped down with damp gauze or other absorbent material until visible drug residue has been removed. The absorbent should then be placed in the nearest biohazard box. The reusable materials should be cleaned in a designated sink with mild detergent and water, and then rinsed thoroughly with clean water for reuse. The cabinet should be cleaned daily with 70% isopropyl alcohol. The cabinet should be decontaminated weekly, whenever spills occur, and when the cabinet requires service or certification. BSCs must be certified by a qualified technician every 6 months or any time the cabinet is moved. Work practices in preparation. Before work begins, all necessary things should be placed in the CPEC, and all unnecessary items should be kept out of the work area to avoid contamination. Because of the pattern of airflow in biological safety cabinets, the following special precautions are necessary. Manipulations should not be performed close to the front grille. Unsterilized items, including liners for hands, must be kept downstream from the working area. Entry and exit of the cabinet should be perpendicular to the front. Rapid lateral hand movements should be avoided. Proper aseptic techniques are essential for workers' protection, as well as patient safety. Labeling. In addition to standard pharmacy labeling practices, all syringes, intravenous bags, and bottles containing hazardous drugs should be labeled with a distinctive warning label such as Special Handling or Disposal Precautions. The Occupational Safety and Health Administration's Danger Communication Standard applies to all liquid and powdered medications that can constitute a health hazard. All liquid and powdered drug labels must therefore include the drug's name, as well as words, pictures, symbols, or a combination of these, that provide at least general information about the drug's hazards, and that, when combined with other information readily available to employees under the Hazard Communication Program, should provide employees with the specific information they need. Needles. Luer lock syringes and needle fittings are recommended to use when it is necessary to administer intravenous to the patients. High-pressure syringing of the solutions can be avoided by using large-bore needles, such as 18 or 20 needles. Large-bore needles are more likely to drip. To avoid these issues, multi-purpose dispensing pins or filter needles are recommended. Drug administration sets should be attached and primed within the hood before the medication is administered to the fluid. All syringes and needles used throughout the preparation process should be disposed of in the needle box without being crushed, clipped, or capped. Vials. Attempting to remove 10 cubic centimeters of fluid from a 10 cubic centimeters vial or pouring 10 cubic centimeters of fluid into an air-filled 10 cubic centimeters vial, both need extremes of positive and negative pressure in pharmaceutical vials. Medication vials must not be vented unless a CPEC is utilized as the work area or a venting device is available to remove the pressure. Filter needles or chemotherapeutic dispensing pins, with membrane filters at the vent, are examples of venting devices that allow outside air to replenish the withdrawn liquid. Before using these gadgets, workers must be properly educated. Although venting devices are recommended, another method is to gradually add diluent to the vial is by injecting small amounts alternately, allowing displaced air to escape into the syringe. Do not inject all of the diluents at once. A significant volume of displaced air will cause the plunger of the syringe to back up, potentially spraying the medicine or causing a leak around the needles. After all of the diluent has been supplied, a little amount of air can be extracted to establish a negative pressure in the vial. However, this should not be ejected into room air because it may contain drug residue. It should either be injected into a vacuum container or discarded from the syringe. When withdrawing the solution, sterile gauze should be put around the needles and vial top. During this procedure, employees should take care to avoid needle sticks. If any negative pressure is required to withdraw a dosage from a stoppered vial, an air-filled syringe should be used to equalize pressure in the stoppered vial. The volume of medicine to be withdrawn can be replaced by introducing small amounts of air into the vial and extracting comparable amounts of liquid until the required volume is extracted. To avoid spraying, the medicine must be removed from the needle and hub neck of the syringe before separation. Packaging hazardous drugs for transport. Wet gauze should be used to wipe the outside of bags or bottles containing the prepared medicine. Wet alcohol pads should be used to wipe entry ports before they are capped. Transport should take place in sealed plastic bags and break-resistant containers. If intravenous bags are spiked at the CPEC pharmacy, they must be carried to the administration location in a secondary container, such as a sealed outer bag. Tablet form hazardous drugs. Tablets that could cause dust or expose the handler to risk must be counted in ACPEC. Unless broken in handling, capsules, such as gel caps or coated pills, are unlikely to cause dust. Because even manual counting devices can be coated with dust from the medications handled, these are tallied in ACPEC on equipment intended for hazardous drugs only. Employees' exposure to this dust is a possibility. Unless an enclosed procedure isolates the hazard from the employees, automated counting devices should not be used. Cleaning automated counting devices using compressed air is not permitted. The pharmacy's CPEC should handle any dangerous medicine tablets that must be smashed before administration. Disposal. Used and empty bottles, syringes, intravenous bags, and tubings should be placed in a biohazard box, red bags. Bottles, syringes without needles, intravenous bags, and tubings containing hazardous medications that are labeled for disposal in blue bins should be deposited in blue bins for proper disposal. All other hazardous pharmaceuticals that aren't labeled or listed for disposal in the blue bin should be disposed of in accordance with the entity's non-hazardous waste disposal requirements. A biohazard box should be used to store contaminated gloves and other discarded PPE. If protective eyewear is worn, it should be cleaned with detergent and washed thoroughly before being reused. Crushed, clipped, or capped needles and syringes should be deposited directly in the needle box. Highlights of the module. Chemotherapy and other hazardous medications need the usage of gloves that have been tested for use with chemotherapy treatments. It is forbidden to eat, drink, smoke, chew gum, apply cosmetics, or store food in the preparation area. Medication vials must not be vented unless a CPEC is utilized as the work area or a venting device is available to remove the pressure. Bottles, syringes without needles, intravenous bags, and tubings containing hazardous medications that are labeled for disposal in blue bins should be deposited in blue bins for proper disposal. Thank you. You have reached the end of this module.